So let's talk about atopic dermatitis. Now, atopic dermatitis is often referred to as eczema. Now, atopic dermatitis is often inherited from family member to family member. Now, it may not be that the other family members had atopic dermatitis, but it could be that patients, family members may have asthma, eczema, seasonal allergies, or even dry skin. And so they can now inherit the tendency of developing atopic dermatitis or eczema. So now, atopic dermatitis can be seen in the first 3 months of life, okay? And so in babies where you can typically see it develop, you can see rashes that can develop on the cheeks, for instance, where it can be rough, dry, maybe even red and itchy. And in severe cases, then you can see pretty much where the skin can open up, crack, bleed, and maybe even drain. Now you can also see it in the creases, like the bends or creases of the wrist, for instance, or the elbows or behind the knees, even the back of the neck. So those are common areas we see in babies and in adolescents. Now the younger kids, adolescents, teenagers, classic bends in the elbows, bends in the knees. But then as we get older, we can see patches really that develop everywhere or anywhere, in all honesty, where they can be just dry, rough, can even be a little bumpy within it and itchy. And so that's how the eczema can start developing from babies on into adulthood. Now, the younger you have it, you have the opportunity of outgrowing it. There's just no guarantee if that will happen or not. Now, things to consider in how to take care of skin with eczema or atopic dermatitis. One, you want to make sure you're avoiding hot showers. So you want to do warm baths or warm showers and avoiding how long we're exposed to the water. So you don't want to hang out too much longer than 10 minutes. That will be tops, because hanging out too long in the water can also cause irritation or further drying of the skin. Now, you also want to stick to fragrance-free products, because products that have perfumes in it can add to the further irritation of the skin. So I recommend doing fragrance-free soaps, fragrance-free moisturizers, fragrance-free laundry detergent, as well as dryer sheets. So everything being fragrance-free, especially if it comes in direct contact with your skin. Okay. Also, suggestion during the seasons where it's cold and dry, maybe using a cool mist humidifier to add more moisture to the air. So those are some of the suggestions that I have in taking care of the skin. Now, some of the things that can provoke or worsen this condition would be things like stress. That's a big one. If you get stressed out or ill, that can cause the condition to flare. So stress and illness. Also talk about allergies. If there are environmental allergies, especially when we see with the weather changes, or food allergies, that can also worsen the skin condition. So something to also consider. The irritation, we talk about fragrances in your products, or even irritation with clothing, wool, things that are coarse fabrics. Those can also cause irritation to the skin and also can worsen the skin condition. So all of these are something that you want to consider when taking care of the skin. Now, in cases where the outbreak is so severe, head to toe, which we have those cases that we see, I do suggest and do recommend seeing an allergy specialist, because in those cases, majority of the time I've seen is that it is some kind of allergy component that may be driving the eczema flare. And so discovering that and getting treatment, such as we call it immunotherapy, can also improve the eczema condition drastically. If we're now reducing those allergens or helping to boost your immune system to reduce your allergy to those components, then we find that the skin repairs and heals and improves, and your flares may be less severe, less severe. And so you have only mild breakouts, if any, because if that was driving it in the first place, then you tend to be really good once your allergy is under control. So all of those are things to consider. Now, things to also consider with atopic dermatitis or eczema: if it's not controlled, one, it can lead to infections. What can happen, because the skin is so open, you can get secondary bacterial infections, you can get secondary fungal infections, viral infections much easier, because your skin is compromised. And when I say compromised, your skin is open, has micro tears in it, so it's easier for those germs to invade and cause problems to your skin later. So you want to make sure that we're taking care of the skin. Okay, so things to consider. In severe cases, for patients that have severe problems, we even implement what we call bleach baths. And so bleach baths are just doing a diluted bleach bath, usually twice, 2 to 3 times a week, depends on severity. And as long as you're able to tolerate it, meaning it's not irritating on your skin. And we're talking about a good dilution, like a 1/4 cup of household bleach, you know, just a regular Clorox bleach, to half a tub of warm water, soaking for 5 minutes, rinsing off right afterwards, and then putting on your medications and moisturizers afterwards. Another recommendation I tell patients is, you know, avoid soaps, even if they're fragrance free, to directly affected areas. And all that means is just because the soaps are still detergents, they can still irritate the skin. I say avoid it there and just use the soap in body folds, right? Your neck, your underarm, the diaper area, sort of kind of the dirty area, so to speak. And then just rinse and wash off regularly with water. So those are some of the suggestions I recommend as well. If you have no oatmeal allergy, taking an oatmeal bath works wonders. There has been research suggesting that colloidal oatmeal actually helps to soften, repair the skin, moisturize the skin. So that also will help in terms of the sensitivity as well as the eczema itself. And I do have patients, their moms come in to let me know that when they have a severe itch, that they give them an oatmeal bath, and that's one of the things they're able to tolerate. So that is definitely something that I would recommend if you're able to do it, even if soaking for like 4-5 minutes in warm bath with oatmeal. So these are some of the suggestions. So understand with eczema, it can come and go. Remember, I talked about earlier that it's something we can outgrow, but it's not, of course, guaranteed. And so I have some patients, or their parents anyway, that come in expecting this one thing to say, hey, how do I get rid of this? And that's not always the case. If it's not driven like allergies, where you can just get immunotherapy and then that takes care of it, or at least takes care of majority of the problem, that's one thing, but that's not always the case. And I prepare patients and parents to know this tends to be a lifelong condition, but it can be controlled, it can be managed appropriately. So we just need to know how to take care of our skin, trying to avoid infections, and make sure we seek the help that we need to make sure this is adequately controlled. Just a little bonus tip here, just to let you know, especially for parents, for kids with severe eczema, if you find that you're not getting adequate sleep, and what we have seen and been suggested even in research is that during those moments, that because they're not getting adequate sleep, we find that they're lower on the growth curve. And what they're suggesting is typically growth hormone is secreted during the REM cycle of sleep. Now, if their sleep is disrupted, then they're not getting as much of that growth hormone. So that's why they're lower on the growth curve. Once we get all of that controlled, it's surprising to see how when we see these patients back and we follow them, how quickly they go through what we call growth spurts, but they're catching up and they're thriving now. And so all of that goes back to what their typical baseline or their norm is, because they're now able to get adequate sleep, because they're now controlling the condition and they're sleeping and resting well. So these are some of the most important reasons why you need to make sure you get your atopic dermatitis / eczema under control, and seek professional help, advice, to make sure we get the care that you need.